Hello everyone and welcome to a special half-hour show. I'm Jeannine Mazurkiwecz. I'm your host for the next 30 minutes and we are proud to be speaking about St. Luke's Hospital and Miners Campus. They're located in Coaldale, Pennsylvania. Today we are going to focus our attention on physical therapy and the umbrella of many of those services. Physical therapy is very important. We're going to talk with three guests today about three entities of physical therapy, and we are proud to first have Tim Kelly on with us. Tim, welcome to the show.
Thank you, Jeannine.
All right, so you are the PT coordinator at physical therapy at St. Luke's, and you are no stranger to the greater Hazleton area.
No, fortunately I've been here a long time, and I was in private practice for 35 years. And we established ourselves in the community and provided services and helped a lot of people with injuries and post-surgical problems. We were approached by other hospital entities and some private physical therapy groups, but I was not comfortable with their priorities or their approach to patient care. With St. Luke's, I feel that their core values and their approach to patient care aligns well with what we established in our private practice. The employees at St. Luke's emphasize these core values, and they use the acronym PCRAFT, which stands for Pride, Compassion, Respect, Accountability, Flexibility, and Teamwork. And these values and this philosophy is one of the draws that helped us make a decision to join St. Luke's staff.
Again, with 35 years experience, to make that connection for you, they really had to be parallel with your professionalism and your expertise in the area of physical therapy. So the local clinics, there are actually 8 local clinics, and you are overseeing 2 of those clinics.
Yes. Presently, I manage the Hazleton and the Cunningham clinics, and they are 8 outpatient clinics in general, in total, sorry. Okay. Hometown, which was one of our previous private offices, Monroe City, Tamaqua, West Penn, Jim Thorpe, and Blakesley.
So you are really encompassing the entire area of northeastern Pennsylvania in 4 counties, Monroe, Carbon, Luzerne, and Schuylkill.
Yes, we are.
And what is the primary concern when you look at physical therapy? Who needs physical therapy?
There's a need for physical therapy at all different age levels.
Okay.
We tend to have therapists that specialize in orthopedic care, post-operative care. There are therapists that specialize in neurological problems, vertigo, TMJ, geriatrics, and pediatrics.
When you look at having a need for physical therapy, obviously we have to look at our finances and budgeting affordability. You have direct access available in your insurance companies with the patients?
Yes, and in the state of Pennsylvania, the physical therapist can apply for a direct access license.
Okay.
At each of our clinics, there is a physical therapist with such a license. This does allow a patient to come for physical therapy without a physician referral for evaluation and or treatment if their insurance company doesn't require that referral.
Okay. So you need to check with your insurance company first.
Certainly.
Okay. So some specialties that you work with as far as in the physical therapy services.
Okay, as I mentioned, we have orthopedic specialists, we have sports medicine specialists, we have lymphedema specialists, hand therapists, a geriatric specialist, and these are all in addition to your normal physical therapy training.
So when, speaking on your experience, when you look at the area of expertise that St. Luke's Hospital and Miners Campus provide, and looking at your experience, what can you say to the viewers who are thinking about physical therapy or any kind of therapy services that they may need? Why choose St. Luke's?
Well, I think St. Luke's provides the expertise, certainly provides convenient locations. And I think with our approach to the patient, our goal is to exceed the expectation that the patient is anticipating. We work closely with all the referring physicians and specialists. On that note, most of our patients are physician referral. And it is important that the public knows that the patient does have a choice who to choose for their physical therapy provider.
Okay, to make it easy on the patient, there is information for any services that St. Luke's Hospital and Miners Campus offers, and you can call it toll-free. It's on your screen, 1-866 St. Luke's. There's also a website. You can find out about doctors, locations, and any other information that you need, and it's sluhn.org. There, you have access to a website, a toll-free number. Either you're more comfortable working with a computer or actually speaking with someone, but you can get all the information you need. Tim, anything in closing?
Well, I welcome anyone to visit any of our locations and speak with our therapist and learn more about the programs we do have. I do want to mention that we do offer at all clinics a community wellness program, which provides supervised exercise programs just to stay healthy. That does not require a physician referral.
Very good.
So you get the expertise of the physical therapists, the athletic trainers, and the wellness directors that will assist them in developing a program.
All right, very good. Thank you. Tim Kelly, again, the PT coordinator for physical therapy at St. Luke's. This is a special half-hour show designed to tell you about St. Luke's Hospital and Miners Campus. They're located in Coaldale, Pennsylvania. When we come back, we will switch our attention over to Ethan Eichhorst. He is the Occupational Therapy Clinical Coordinator for Physical Therapy at St. Luke's. We'll be back right after this. Welcome back. You're watching SSP TV. I'm your host, Jeannine Mazurkiwecz. We are in the midst of a half-hour show focusing on St. Luke's Hospital and Miners Campus. We are focusing our attention today on physical therapy amongst all the services that they offer at St. Luke's. We just spoke with Tim Kelly, the PT coordinator at physical therapy at St. Luke's, and now we are going to be joined with Ethan Eichhorst. He is a clinical coordinator, occupational therapy of physical therapy at St. Luke's. You are reminded that on your screen there is a toll-free number and a website if you want any information on services, you want to find a location or even a doctor. All that information is up on your screen. This show is also available online at ssptv.com. All right, Ethan, thanks for joining us here on the program.
Thank you very much.
We're talking about St. Luke's and all of the benefits of getting some care and services through the physical therapy that you offer. So first, I know some people are out there and they're thinking, Ethan looks a little bit familiar to the area. So tell us about your background.
Well, I grew up in Hazleton. I went to school at Bishop Hayfie High School.
So did I.
Oh, really? There you go. And then that closed, and I eventually was at Hazleton area. I played basketball there at Hayfie and Hazleton. So, if any local sports people are out there, they hopefully remember my name.
We won't say what years we graduated, because I have a feeling that I graduated before you did.
Possibly. And then I also played local college basketball at Misericordia University.
Okay.
And then that's where I got my master's degree in occupational therapy. But then also I have a certificate in ergonomics assessment specialist.
Right.
So we also go into like workplaces and assess how their workstations are and try to prevent injuries before they occur, things like that. So we have some contracts with some local factories that we also work with. So that's another aspect of physical therapy at St. Luke's.
Okay, did you say you were a coach right now?
Oh yes, I'm also the head coach, boys varsity basketball at Monterey area.
She's just the head coach. Forgot to put that in there.
Yeah, this year I just took the position, so I'm down in the Schuylkill County coaching down there. So it's a great opportunity to, teach all my guys some of the stuff I've learned over the years. With that being said, with the sports programs down in the Schuylkill County, we at St. Luke's have the PIAA contract for District 11. So at pretty much all the sporting events, whether it's basketball, football, I believe like volleyball, like pretty much a majority of the sporting events, track and field, we have one of our physicians there, and then we also have one of our athletic trainers and one of our rehab staff, whether it's a PT or an OT, on site for every sporting event in case any injuries happen during the game.
Well, you're definitely busy. You also have a fiance?
Yes, Kelly DeCosmo. She works at Sophie Jewelers in Hazleton as well. She's a big supporter of the rehab services and everything, and coaching in the area.
Very good. Okay, so occupational therapy, why is it important for people to actually get this?
So occupational therapy, if some people don't know what it is exactly, we kind of are the same as physical therapy, a little bit different. We focus more on upper extremity rehab in the outpatient setting, which is what our 8 clinics are. So that could be either neurological, orthopedic services, for any post-op surgeries, anything like that. We also do splinting, for status post-op, or even if there's any genetic disorders at all. I've done pediatric splinting for, after birth disorders, things like that. And then on the geriatric side, we do activities of daily living, which is how well somebody could bathe themselves, dress themselves, groom themselves, feeding, things like that. We take it for granted now because those things are, second nature to us. But after an injury, especially if you have a knee replacement or something, it's going to be difficult for you to put your shoes on and your pants on. So we kind of re-educate them and teach them, use different adaptive equipment to kind of help them get back to where they were before the surgery occurred or the injury occurred.
You mentioned, as I did earlier in the program, that there are 8 clinics. At each of those 8 clinics, do you have all of these services available?
Physical therapy is at all 8 clinics.
Okay.
I'm actually the only current occupational therapy within the St. Luke's network. There's also another CODA that works with me. So the OT services are offered at Monterey City, Tamaqua, Blakesley, Jim Thorpe right now. So those are the locations that I cover throughout the week. Eventually, as we expand and grow, which we are doing a lot of, hopefully we'll be able to go into all the other clinics as well.
So it sounds to me that you deal with patients that are adolescent and younger, all the way up to people who are elderly.
Yes, we could kind of deal with anything, even school-related stuff for the younger kids, whether it's handwriting or behavioral stuff with autism kids. It's a pretty broad scope. So yeah, from anything from, like I said, splinting for a 6-month-old to teaching a 80-year-old how to put some shoes on.
What if we're dealing with, you might have a stubborn husband or a person out there who does not want to get this occupational therapy? What can you tell that person watching out there who's thinking, I could do this myself. I was in an accident, I don't care. They're really blinded to the situation that they do need to seek some professional help. What is your advice to someone who is either dealing with someone who's been in an accident or needs that care, or someone at home who really is suffering and just is stubborn and doesn't want to pick up the phone?
Yeah, we do see that a lot. whether it's a stubborn patient or a stubborn caregiver, we stress that, you don't want to let it go too far because, further injury could occur, anything could really happen along those lines. So the services that we provide would be, what you need. You could visit one of our clinics, look around, see what we're doing. Also, talk to your family physician. He can make a referral to any one of our services. He'd also know best whether if you need the services or not. But overall, you definitely, if you have any status post-injury, even if it's, gaining some strength just to make it a little bit easier on yourself or your caregiver, those things that you have to consider as well.
Okay. Anything in closing?
No, that if you have any injuries, whether it's sports related or just related to old age, anything, if you fall at home, anything like that, just seek out your family physician, or if through the hospital-based setting, we get referrals through them as well. It's just really important to, as Tim said earlier, stay healthy, and that'll prevent a lot of things from happening, injuries that we see throughout the day. So that's probably about it.
All right, Ethan, thanks for joining us. I wish you well with your engagement. We can't wait
Thank
to
you very
hear
much.
an update on when the wedding will be. And I love going to Sophie Jewelers. That's one of my favorite places to shop.
It's great to hear.
When we come back, we continue our conversation on St. Luke's Hospital and Miners Campus. We heard from Tim Kelly, the PT coordinator. We just spoke with Ethan Eichhorst, on the clinical coordinator for occupational therapy. Next up, we are going to talk about speech-language pathology with a speech-language pathologist, Brianna Hinsey. And she is with physical therapy at St. Luke's as well. Again, all that information that you need is on your screen, toll-free number, and a website. You're watching SSP TV. We'll be right back. Welcome back. You're watching a half-hour special on St. Luke's Hospital and Miners Campus, and we are specifically speaking about physical therapy services. Right now I'm joined with Brianna Hinsey. Am I saying your name correctly now?
Yes.
Brianna Hinsey,
Yep.
and she is a speech-language pathologist.
Yes.
All right. Well, thanks for joining us on the program.
Thank you for having me.
Talk about your background, first of all, and your experience.
Well, I went to Lehighton High School, just over the mountain, and following my graduation there, I went and got my undergrad degree at Wilkes University in Wilkes-Barre. I got my bachelor's in psychology, biology, and I had a minor in neuroscience. And when I went on for my master's, I, like Ethan, went on to Misericordia, and I got my master's in speech-language pathology there.
Okay, so under speech pathology, there are actually 3 different disciplines that we are going to educate our viewers on today.
Yeah, so the most common is speech, spoken language, and that's the one that we probably are most known for. And that includes anything from aphasias that come on because of a stroke or a head injury, and then something as simple as an articulation error in a child that can't say their R, or they have another articulation error that we work toward, as well as stuttering therapy. That's all in the speech realm of speech therapy. Probably our biggest discipline is our cognitive therapy. So that works on memory or attention. And those deficits usually go unheard of. We usually, we don't have a patient come forward, we have a spouse come forward that their memory has changed or something about their attention has changed. And that can follow a stroke or a head injury, like I mentioned. Cognitive therapy is more common in our geriatric population as well as our neuro disorders, like our Parkinson's and MS patients. We usually do memory therapy with those individuals. And then the third discipline is truly my favorite, is swallowing therapy within speech therapy. Because it's not in our name, a lot of people don't know that you would see a speech therapist if you were to have a swallowing deficit or change, and that can be brought on by ALS. Always results in some swallowing deficit, so we try to maintain it and keep a quality of life there for that patient, because we take so much pleasure from eating. Swallowing is my favorite therapy because I see the biggest milestones, and we see a lot of that in the elderly population, but too with any type of head injury, all the way down to babies. Not all babies are born knowing how to eat, so we work with them as well to make sure they're able to sustain themselves.
Would you also be working with cancer patients, tongue, throat cancer?
Yes, so head and neck cancer, unfortunately, is very prevalent in this area. We have a large smoking population, the mining history that we have in this area. A lot of people didn't know the way to protect themselves. Chew tobacco has come back on the scene also. It took a little hiatus, and now it seems to be more prevalent. So we see a lot of tongue resections, total glossectomies where the tongue is removed entirely. We work with those patients to rehab them, because the therapy they receive for their cancer can also be damaging to their swallow, and they're made aware of that. So we try to maintain that while they go through their therapies.
Okay, so let's talk about speech therapy when it comes to a child. Mom, dad, a guardian, a foster parent is with a child, and they might have that gut instinct that there is something wrong with the way the child is speaking. What do they do from there?
So a lot of that depends, one, on your child's age. A lot of parents will come to me and they'll say, she's a late talker, or I was a late talker, I think that's all this is. The best thing you can do is approach your pediatrician, obviously. And if the pediatrician expresses concern, or if your parenting instinct takes over and you have worries, it's fine to come in and we'll just get an evaluation done and see if there is anything that's worth treating, or maybe your child is on track and you're not aware of those milestones that they should be hitting. But we can always take that approach. If you come in and do an evaluation, we would have a better idea. I always encourage parents to be aggressive, not sweep it under the rug. The sooner we're able to address a speech deficit, if there is one, the easier it is to rehab. So that's kind of the approach we take. The sooner the better.
You hit on a good point, because there are so many variables involved. If they have older siblings, or maybe the younger child is just pointing at things because they have other children or people talking for them, they're around adults. So there are a lot of variables that go into play. Okay, so from a child to an adult needing some speech therapy, what are the signs, or what do you recommend to someone at home watching?
So usually our biggest indicator is a diagnosis. If there's been a diagnosis of a stroke or a Parkinson's or an ALS, if there's been any head trauma, something as simple as a concussion can cause memory loss. It may be short-term memory loss, or you may find you're losing memories of your childhood. We try to look at all those different realms and discuss with the patient and the loved ones that knew them prior to their injury, and try to get them back to that baseline functioning that they had before everything occurred. With adults, we see a lot of resistance. Kids can't fight their parents. They go to therapy because the parents want them to. But in an adult, it's hard to admit that maybe your memory isn't where it used to be, or maybe the stroke has affected you in ways other than the obvious, the physical, your arm and your leg. Things that have changed in the brain, sometimes they go unnoticed, and that's something that we really try to approach kindly and from an understanding standpoint, because it's difficult on the patient and the caregiver. But once we find that there are deficits, we try to get people back to life as they knew it. I give memory strategies or home programs so that speech therapy isn't a long month, a month on top of month therapy. It's something that I want you to get back to life as soon as possible. If I can help you to do that on your own, then I try to do that as quickly as possible. But our elderly population, they take a little more convincing, but I think they'll find that once they're in the door, we try to make them comfortable and we get them back to life as they knew it as fast as we can.
Well, in America, we want it yesterday. So
Right.
if we come in, we want results yesterday. So as you mentioned, everyone is, I'm assuming, on a case-by-case basis, but this is something that you can really go into speech language and get improvements within a couple weeks.
Absolutely. A lot of people, when I say a diagnosis, not all strokes need speech therapy the same way not all strokes need other therapies or other disciplines. It's definitely on a case-by-case basis. There are things about speech therapy that kind of go under the radar, the memory, the attention, and we have a lot of patients that they'll come to me following a stroke or a diagnosis of Parkinson's, and they will say, my speech is fine. And I agree your speech is fine, but I might be seeing you for another discipline. It might be cognitive therapy, or it might be that your swallowing has changed. Maybe after a head injury, you noticed you're coughing more at home, or you're having trouble swallowing things and you weren't previously. That could be a sign of something to come and something that we want to be aware of and really nip it in the bud as quickly as possible so that it doesn't become a bigger issue.
Okay, so where are you located, or is this available at all of the 8 clinics?
We're available, we're expanding, the same as
Right.
occupational therapy. I myself and my colleague, we're in the Mahanoy City office, the hometown office, Tamaqua, and Jim Thorpe. And then we're hoping to expand north as the patients come in and need our services. And then obviously we're also at the Miners campus. We also serve in the hospital as well.
Okay, anything in closing?
I guess just to touch on Tim and Ethan's points earlier, it doesn't hurt to be overly cautious and to be active. And even the most active people can have an injury. You could be the safest driver in the world and unfortunately be involved in an accident that was in no way your fault. But if you're sitting at home and you feel that one or more of these therapies would benefit you, it doesn't hurt to look into it. I find in speech therapy, patients that won't seek it out for themselves would have seeked it out for a loved one. Usually the patients I acquire are patients that have always taken care of others and they don't feel that they can take care of themselves. It's uncomfortable to put the spotlight on them a little bit, but you owe it to yourself to have an evaluation if you feel you need one or if you have a loved one that may need one and see if they can benefit in some way.
Very good. Lots of information on today's show focusing on St. Luke's Hospital and Miners Campus. I want to thank Brianna and also Tim and Ethan for coming on the show with me today. Again, if you want any more additional information, you can go to the toll-free number. It's 1-866-St. Luke's. Also, you can check out the website, sluhn.org. You can find a doctor, you can find a location, and you can also find information on all of the services provided at St. Luke's Hospital and Miners Campus in Coaldale. You can watch the show on SSP TV or ssptv.com. I was your host for today, Jeannine Mazurkiwecz, and we'll see you next time.